Of this week is titled Postoperative Pain of Single Visit Endodontic Treatment with Getapercha versus MTA Filling, a randomized superiority trial, which was conducted by Mahmoud Torabinejad and his group from Iran and published in BMC Oral Health in 2023. Postoperative pain has remained a challenge for clinicians. This randomized superiority trial compared the levels of postoperative pain following the use of gutta-percha and sealer or MTA as root canal filling materials in teeth with asymptomatic apical periodontitis. Inclusion criteria in this study consisted of participants aged 18 to 65 years that had a restorable single canal maxillary or mandibular premolar with asymptomatic apical periodontitis and necrotic bulb confirmed using cold test and periapical radiography with periapical index of 3, 4, or 5 without any pre-operative pain, and the exclusion criteria included retreatment cases, teeth with periapical index of 1 or 2, and patients taking an analgesic during the past 12 hours. Were assessed for eligibility, and they excluded 19 patients, 15 of them for not meeting the inclusion criteria, which I just mentioned, and 4 of them declined to participate. The left are 100 patients. They allocated them. 50 patients received the MTA treatment, and the other 50 received the gutta-percha and sealer treatment. Then they followed up these patients. One of the patients on the gutta-percha group did not answer the telephone, and on the analysis, they analyzed 46 patients from the gutta-percha and sealer group, since 3 of them were excluded for using medication, and 48 patients from the MTA group, since they excluded 2 of them for using medication. Canals were prepared by ProTaper universal rotary files using the crown down technique until F3 size. And following root canal preparation, the root of each group was filled with either gutta-percha and AH plus sealer or an MTA apical plug with a length of 3 to 5 millimeter following thermoplastic gutta-percha filling on the other group. So in order to assess the severity of postoperative pain, the participants were instructed to rate their pain level 6, 12, 24, 48, and 72 hours after treatment using questionnaire containing a 10-point visual analog scale. And the result showed maximum pain intensity after 6 hours, which decreased significantly over time in both groups. The mean visual scale analog score were significantly lower in the MTA filling group than in the gutta-percha group samples filled with GP and sealer at all time points. And in terms of gender, the female patients reported higher scores in both groups after 6 and 12 hours, but not at other time intervals. And when splitting the groups by tooth location, it resulted in no significant difference between the maxillary and mandibular teeth in both groups. So in conclusion, considering the lower postoperative pain of MTA as root canal filling material, it may be a valuable option for clinicians. Although there are some animal models indicated that the MTA induces some analgesic effect and reduces the nerve activity. However, the exact mechanism for lower pain levels remains unknown and further research are required.